So I am so excited to get started with this presentation. Feel free as you're joining us to go ahead and introduce yourself in the chat. A few housekeeping items about this webinar. It is being recorded, and that is good because I will be sending out a follow-up email with this recording and the PDF of this PowerPoint. So if you're a notes taker, that is great. Take notes. But do know that you will get a PDF of this presentation along with the recording of this webinar. And I will also be sending out a survey about the presentation itself. If you have questions, please do put those in the chat. Since I'm presenting on my own today, I will likely look back in the chat and answer those at the end of the presentation. So do go ahead. I want it to be interactive. I want all your questions answered. And we will have time to do that at the end of the presentation. Right now I have my camera on, but as I start the presentation after I introduce myself, I am going to turn that off. It helps with our video playing the bandwidth. And so I will be turning off my camera. So thank you so much for coming today to learn about Count the Kicks, Saving Babies with Us, a guide to talking to expectant parents about fetal movement monitoring. And we just so appreciate the invitation to do that and that you are taking the time to learn with us. So I am Jen Rowry, and as the Associate Director of Engagement for Healthy Birthday, Inc., the nonprofit that runs the public health campaign, stillbirth prevention campaign, Count the Kicks, it is my passion to shine a light on the silent epidemic of stillbirth in this nation, to have those important discussions, and to also provide you with solutions, because so often we talk about problems in this country, but we don't have solutions. And today I am able to provide you one solution that you can apply with your clients, your patients, your friends, your family, your neighbors. And so that's really exciting to me to be able to do that with you today. I have a passion for education. I'm trained as a high school educator and have come to this work personally because I am next door neighbors with one of the founders of our organization, Carrie Biondi Moreland. And I was her neighbor in the early 2000s, 2003, when her daughter Grace was born still. And it was a situation that impacted my heart and my need for change as well. And I've listened to this organization grow over the years, joined the team about 4 years ago. And again, spending time educating and engaging advocates of change and partners. And that education is so important. Knowledge is power, is my belief. So I would love to dive in and get started in sharing this important education. And I am going to go ahead now and turn my camera off. And so we will move forward. Today, I'm going to start with this wonderful video, a Good Morning America video about the power of our app. And we know the power of mom-to-mom storytelling is really important on the actions of others. When a mom shares her story, her testimony, how others will listen and take that information. And it's just a feel-good story and shows you a little bit more about how this app works. It is a baby save story, as we would call it. And I would just like to highlight that you should listen to the words of Mom Emily Ecoff very closely, because she's going to be highlighting some changes that she experienced and why she spoke up and why she knew to speak up. And those are going to be important triggers for providers, for supporters of expectant parents, or expectant parents themselves to know. And we're going to talk about those changes in movement later in the presentation. So sit back and enjoy this very short but powerful clip.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
Life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
So that is Ruby's story, and we are going to go back to those changes in movement that Emily mentioned and the types of changes in movement. So what is Count the Kicks? It is a highly effective, evidence-based stillbirth prevention campaign that has been developed as an early warning system for moms. We save 1 in 3 at-risk babies here in Iowa. Our campaign is ready to go and low cost. And thanks to with the Department of Health in your state, we actually have a lot to offer for free. So it's a win-win. Before we get started, I think it's extremely important to level the playing ground. And so this is a stillbirth prevention campaign. And we want to make sure that we define what stillbirth is. In the United States, stillbirth is defined as the loss of a baby after 20 weeks of pregnancy. Stillbirth is further classified as early, late, or term. And so when we look at those weeks, the early is 20 to 27 weeks of completed pregnancy. Late is 28 weeks to 36 weeks. 28 weeks is when the 3rd trimester of pregnancy begins. And then term is actually 37 to delivery, to time of delivery. And so please note that our campaign spends a lot of time focused on that 3rd trimester of pregnancy. And we will talk more about that as we go. Sadly, in this country, what's not spoken of enough is that we're losing 23,000 plus babies a year to stillbirth on average. And that is an unacceptable number that needs to be talked about so that we can change it. The difference between stillbirth and miscarriage is defined as that loss before the 20th week in pregnancy. And then infant mortality is a baby that took a breath on this earth and passes before or by their 1st birthday would be infant mortality. And on an average in this country, again, sadly, we're losing around 22,000 babies a year to infant mortality. Take note of a couple of things. One, we lose more babies to stillbirth than infant mortality, but we're simply not talking about it. We need to be talking about stillbirth and infant mortality and miscarriage and the ways that we can support and prevent. Also, there are links to the research. We are an evidence-based campaign, and so you'll notice there's a link here at the bottom showing where we got the information about stillbirth. You will see those throughout the presentation, and you can find so much on our website about research and data at www.counttthekicks.org if you want to dig in further. So what is the stillbirth by the numbers? What is our national data? So on average in this country, we lose a baby in every 1 in 169 pregnancies. But when we look at this by race, this is where we know that there's a lot of work to be done. And these numbers are unacceptable numbers. A Black expectant parent loses a baby in every 1 in 96 pregnancies. That means more than 2 times more likely to lose a baby to stillbirth than her white friend, neighbor, or counterpart. Hispanic mamas are also at risk of losing their babies at 1 in 199 And then the indigenous population, again, a very high risk population for stillbirth. Every 1 in 138 pregnancies ends in stillbirth, sadly, for that group of individuals. For white expectant parents, the number's 1 in every 204 pregnancies. For Asian Pacific Islanders, one in every 233 pregnancies. And again, I mentioned this, that it's just as prevalent, actually more prevalent than infant mortality in this country, and 10 times more likely than SIDS. And not because we shouldn't be addressing and talking about those things, but just to show you the prevalence of stillbirth and the fact that we have to make a change. What does stillbirth look like in your state? We see even more disparities in the South. So I said that a Black expectant parent in this country is more than 2 times as likely to lose their baby to stillbirth as their white friend, neighbor, or counterpart. In a lot of southern states, and Georgia also reflects this, that number actually can be up to 3 times greater. And so we have to address that. So you can see on the chart in front of you that Georgia's overall stillbirth rate is 8.02. That means 8 babies on average out of every 1,000 births is lost to stillbirth. That is significantly higher than the national average, which is in 5.95 babies per 1,000. And so you can see that graph in the top left-hand corner. The red is Georgia, the blue is the United States, and the yellow is Iowa. And you can see that that trend over time. Basically, stillbirth has remained fairly stagnant in Georgia. Iowa is below that national average, and we'll talk more about that. So what does that mean in the number of lives? Because we need to think of it not just in numbers, but in lives and the people impacted. Every year, on average, Georgia loses 1,041 babies to stillbirth. We believe that if we could save 1 in 3 at-risk babies in Georgia, like we are doing in Iowa, that 333 babies on average could come home to their families each year. And that is worth the discussion. That is worth change. And that is why you're here to partner with us. So let's talk about that Iowa stillbirth data. So our organization was founded in the state of Iowa. It is now a national organization, but very much was focused on saturating Count the Kicks education across the state of Iowa. And that began in the 2008 timeframe, when our nonprofit and the Count the Kicks campaign really came into play. And you can see that dotted line and the blue dots and the red line here. Let's talk about that. So the red line is the national average. Unfortunately, we are slow in this country to research. We do not do enough research, and we are also slow on reporting data. This information is from the CDC Wonder, and you can see that national average. And then the blue dots are Iowa. Over the space of time, starting in 2003, where it was climbing, 2008, where Count the Kicks came in. And yes, there are outlier years, things like, and especially in a low birth rate state like Iowa, a syphilis outbreak could impact stillbirth numbers. There could be a pandemic, which can impact stillbirth numbers. So there are going to be outlier years, but you see that dotted trend line, that downward trend line is exactly what that 32% reduction indicates. We have researched this, and we will be releasing more research supporting the evidence that Iowa, while the rest of the nation has remained relatively stagnant, has definitely been impacted by the Count the Kicks campaign. And we're excited to have that happen in the state of Georgia as well. So in 2020, preliminary Iowa stillbirth, the preliminary Iowa stillbirth rate is 4.0 fetal deaths per 1,000 live births. It is the second lowest Iowa stillbirth rate on record after 2018, which was one of the lowest in the United States. So we're really excited to see that this campaign is working in our state, and we're starting to see that trend in states that we've expanded to. Illinois, Kansas, and Nebraska are also seeing downward trends, and that is exciting since our campaign has been there for just a handful of years. Disparities. I said we were going to talk about this. Why are there such large disparities? I don't think these are going to be shocking, but research studies, we've gathered this information from a variety of research studies, and essentially this is the result of what those studies are saying. Researchers point to the following as causes for these disparities: systemic racism, toxic stress, epigenetics, a predisposition to certain conditions, access to healthcare, socioeconomic barriers. And when we talk about like those predispositions to certain health conditions, that's a result of the toxic stress created by systemic racism. Things like gestational diabetes, preeclampsia can be linked to that toxic stress caused by systemic racism. And then the temporary change to DNA sequence caused by that toxic stress. We know that early access to healthcare in a pregnancy, even pre-conception healthcare, is extremely important to the health of a pregnancy. So if there are barriers and expectant parents are not being seen late into their pregnancy, that isn't an issue and can cause disparities. Those socioeconomic barriers that we see across the country in rural areas, in urban areas, can be a contributing factor, but also highlighting that research shows education is not a determining factor. A college-educated Black woman is still more likely to lose her baby than a high school educated white woman. And so we've got to address the systemic racism. There has to be systems change, but there also has to be grassroots change. And that's why I'm so excited for the doulas and everybody in the nonprofit world and community-based organizations that are doing the good work in their own backyards and making change. So what is Count the Kicks doing to reduce disparities in stillbirth? We do have a health equity coordinator on staff who helps to train us to look at our internal systems. We are always looking for funding opportunities to be able to gain funds to help reduce those disparities in stillbirth. Our board and staff are 100% trained on anti-oppression and structural racism. We hold focus groups. We look at the lived experiences of women of color to improve our programming. We want to work with and mark communities that are being marginalized. This says our app is in 12 languages, but that actually has changed recently, and we have our app in 14 languages currently, and that number is growing, trying to knock down barriers and make it as inclusive as possible. Our materials are culturally appropriate, and we have our FAQs, printed materials, and videos in multiple languages. Again, trying to knock down barriers, trying to give access to as many parties as possible. We are a research and evidence-based organization. Actually, our organization was founded out of loss. 5 Central Iowa women lost daughters in the early 2000s. And 4 of them to stillbirth, 1 to infant death. And they came together in their grief, connected through friends and pastors. And what they've discovered is that they all had similarities in their story. They were all told that stillbirth really doesn't happen that often, that it was just really rare, except for these 5 women within months or years of each other had lost babies to stillbirth and found one another. And they knew that wasn't true. They knew there wasn't enough research, enough data on the topic. They asked hard questions that didn't have good answers. And so their first action actually was to create the first stillbirth registry in the country, trying to collect that data, do that research. If you don't know that you have a problem, and then you know you have a problem, but you don't know why you have a problem, it's really hard to create a solution to the problem. And so that was their goal, is to create that solution. And where they really found that solution was when they were presenting on the work they'd done here in Iowa to create the first national stillbirth registry. They were at a conference presenting, but they also attended presentations, and they attended this presentation done by a study done in Norway with researchers, one of them being Dr. Ruth Fretz, the only American researcher, that indicated that the cohort of expectant parents that were educated to track their baby's movement in the 3rd trimester, learn their baby's normal movement pattern, and to speak up if they noticed a change. Again, their providers were trained to listen and take their concerns seriously. And what happened in that cohort was about a 30% reduction in the stillbirth rate. And that's when our founders, Janet and Tiffin, listening to that presentation, said, that's it. That's what we want to do. That's a solution that we can help. And that's where Count the Kicks was born. I love this quote by Dr. Ruth Fretz, who continues to sit on our medical advisory board and is a huge ally for our organization. But I love this quote. She says, tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the 3rd trimester of pregnancy. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement pattern starting at 28 weeks and to speak up if they notice a change. And that's why we're here today. Let's talk about it. Again, just supporting that our organization is research and evidence-based. In fact, the Association of Maternal Child Health Programs, which is essentially the membership organization for state health departments, has approved Count the Kicks as a best practice after that thorough scientific review and support our work. And we're super excited about their partnership and support to change things. The CDC is telling women that one of the 15 urgent warning signs for a pregnant woman is a change in her baby's movement. We know that movement matters, so let's have a way to help moms get educated, track that movement, and have the power to speak up. Kick counting has one of the arguments that providers or other individuals may have is that it's going to create this influx of panicked moms, anxiety-ridden moms, hundreds of phone calls about movement. And so this has actually been studied by us and by others. You can see the sightings at the bottom of the slide that says one potential side effect of routine monitoring of fetal movement could be an increase in prenatal visits, either outpatient or in the hospital. However, most research has not found this type of increase to be true. Usually, the fetal movement count is reassuring to pregnant women and prevents unnecessary visits. And that was a quote out of the Des Moines University and Harkin Institute study on our app users. And actually, it says that 77% of our app users actually report feeling less anxious because they're in tune with their baby, they're in tune with their body. They know when they need to be concerned and when they need to speak up. And so they are a partner in their care. 84% of our app users, and I think this is a really huge statistic, not every person is going to need to use this education to get their baby here safely. They won't have that problem in their pregnancy, but everyone needs to bond with that baby, and the sooner the better, right? 84% of our app users stated that regular tracking was associated with feelings of bonding. And I think that that's the win, connecting siblings and partners to that experience and that connection with expectant parent to baby prenatally can help reduce those ACEs and adverse childhood experiences when baby arrives. It's going to help mom in that postpartum period. And so I love that about our app. We believe that not only is the Count the Kicks a part of reducing the stillbirth rate, it actually could help reduce the preterm birth rate, could identify fetal growth restrictions earlier. And women who, I'll come back to that. I want to go back to that reduction of preterm birth rate. I actually have a story to share. So our own executive director was a reporter who did a news story on the launch of Count the Kicks in Iowa in the early times, like 2008, 2009 timeframe. She actually used the education she learned from the story that she did on the launch of the campaign to save her own child, to slow down her own labor. So she noticed a change in her son's movement about a year to the day after the story that she did, and knew to speak up because of the education she'd received. She went to the doctor, who took it seriously, had her checked out. And the one thing that they noticed is they said, hey, you're in preterm labor. This is not something that she realized. She was not in pain. She did not know she was having contractions. So her son's movement change was actually what triggered her to speak up. They were able to, intervene early and with bed rest and medication, stop her labor. And she carried her son, Hayden, for the full 40 weeks. So it actually helped get him here safely instead of that early 30-week NICU delivery where there's lots of risk factors. Fetal growth restrictions can be identified earlier because babies that slow down in growth aren't getting what they need. There could be a blood clot in the cord. There could be a placental issue, but for whatever reason, there could be a knot. Something's restricting them from getting the blood flow, the oxygen, the nutrients they need to grow. And so their growth over time changes. And so if we can identify that earlier, we can identify a problem earlier, the chance of getting that baby here safely increases tremendously. One thing that I do want to point out, that women who have stillbirths are substantially higher have higher risk for maternal morbidity or like severe health problems themselves than other women, up to 4 times more likely, in fact. And so we want to be also an answer for that maternal morbidity and mortality topic. And so I have a great story out of the state of Ohio. Baby Save Rocco. His mom is a 4th-time mom. She's a nurse practitioner, and she noticed, and she was counting her kicks daily using the free Count the Kicks app, and she noticed her baby's movement had changed. She spoke up to her provider. This is a very experienced individual, 4th baby, a medical professional herself. And so she spoke up with the encouragement of her husband, actually. And when they went in to assess baby and mom, guess what? Baby was showing signs of distress because mom's blood pressure had skyrocketed. And she was at risk for stroke and other serious issues. So although she didn't identify herself any change, baby's movement triggered her to speak up and actually prevented problems for mom and for baby, because we know their health is intrinsically linked during that time period. And this is really exciting. This was just announced yesterday. This is brand new. And so before we go further, I want to take a moment to share the newest resource for the general public, but also especially for those that care for expectant parents. We have just released a white paper with the Harkin Institute titled "The Link Between Stillbirth and Maternal Mortality and Morbidity: Firsthand Accounts from American Women." The purpose of this white paper is to highlight the connection between stillbirth and maternal mortality and morbidity, and how Count the Kicks can help improve health outcomes for expectant parents and babies. Research shows that the risk of severe maternal morbidity is more than 4 times higher among stillbirth deliveries compared with live births. As we have already discussed, racial discrimination is a significant risk factor for adverse birth outcomes. According to the CDC, white women make up 13.4% of deaths due to pregnancy-related causes, while African American women make up 41.7% of pregnancy-related deaths. That rate is similar to that of women in developing countries. So we have a lot of work to do in America. Implicit bias is an immediate and large part of this systemic issue, and we must take immediate action to counteract it. This white paper highlights these disparities and tells the stories of 8 women who almost lost their own lives due to pregnancy-related complications. These first-hand accounts illustrate how a change in a baby's movement can be a red flag for both moms and their babies, and how counting kicks and being monitored for reduced fetal movement led to improved birth outcomes for both mother and the baby. The white paper shares real solutions. Again, I said I was here to share solutions, real solutions, and clearly notes that Count the Kicks is one evidence-based tool to help improve birth outcomes for expectant parents and their babies. If you'd like to read the full report, visit the link on this slide. And again, I'll be sharing the links for you after the presentation in a follow-up email so that you can look for more information on the report. So I am so excited to share that with you. Again, if you're somebody that wants to dig in and learn more, here's links to additional research studies. Again, go to www.countthekicks.org, and we share a lot of research and evidence on stillbirth and stillbirth prevention and fetal movement monitoring there. So that's our history. That's who we are. That's how we're impacting change. And hopefully you can get the sense that it's something that everybody should know about and can apply. And so let's talk about Count the Kicks, the implementation, and how you can make a difference. So Count the Kicks, as you know, is a stillbirth prevention campaign. It's evidence-based. It is mom-focused. Take note, really important to our founders that this not be a fear-based campaign, that this not be medical and heavy, but it be even down to our colors and our descriptions, it be very mom-centered. It be the education be focused on mom and not medical, and that it would be attractive. It's something to educate women on the importance of tracking fetal movement, either using that free app we're going to talk about or paper charts. And it empowers, it's an empowering campaign for expectant parents to speak up to their providers if they have a concern. So let's talk about, why does movement matter? Movement is one very important way that a baby communicates before birth. A change in a baby's movement can be an early sign and sometimes only warning sign that a baby may give when in distress. Why does a baby's movement change when they are in distress? So a baby is just like you and I. When I don't feel well, when I've had the flu, I slow down. I go to my couch. I go to my bed. I don't go out for my daily run, or I don't go to work. I feel crappy, so I slow down and I conserve my energy. Babies are the same way. When they are not getting what they need, when they're in distress and not feeling well, they're gonna show that through their movement. They're gonna slow down. They're gonna conserve energy. They may even be in such distress that their body naturally protects their heart and their brain, and so their extremities are not getting the blood flow they need. A baby's movement could be weaker. A strength of movement can be an indication of a change. Think about, again, when you've been ill after a bout of the stomach virus. I don't just run up my stairs to my bedroom like I normally do without thinking of it. It's a lot of work. I might feel weak and shaky and sweaty. I'm trying to exert myself. So again, strength of movement, a slowdown in movement, strength of movement, but also there is a third type of movement change. So let's talk about those. So I just talked about how baby could slow down. I talked about how baby's strength of movement could change. And the third type of movement change is a sudden or wild surge of movement. Can also be an important sign of distress. Women that have experienced this describe it as almost violent type of movement. And it's very noticeable. And it is also a third type of warning sign, and one that mom needs to make sure she gets checked out immediately. Since kicks matter, let's start counting. When should a mom start counting the kicks? Well, that beginning of that third trimester is 28 weeks in gestation, or 26 weeks if you're considered to be in a high-risk pregnancy. This is when research indicates that baby has established a consistent pattern that mom can feel and track. And so that is why we recommend 26 weeks for high-risk mamas and 28 weeks if it is a normal pregnancy. And that, again, is the beginning of the third trimester. What counts as a kick? This is important. Rolls, kicks, jabs, pushes, anything except for hiccups, because they are involuntary movements. So we do not count hiccups, but anything else is considered movement and should be counted. So how to count the kicks to be in tune with your baby and your body. Here are 5 simple steps. Track your baby's movement with the free Count the Kicks app, or download a Count the Kicks paper chart at countthekicks.org. Count your baby's movements daily, preferably at the same time each day, and if possible in the evening. Find a time where your baby is normally active and use that as an indicator of when is a good time to monitor movement. Again, if possible to do it in the evening, research indicates that healthy babies move more in the evening. It'd be great if you could do it in the evening, but preferably once a day at an active time of day, every single day. And then you're going to track the time it takes for your baby to get to 10 movements. So over a course of a few days, up to a week of tracking movement, the expectant parent should be able to find kind of their normal. Okay, so my baby's normal might be 10 movements in 10 minutes, where your baby's normal would be totally different. Every baby, every pregnancy is different. And so your baby's normal may be 30 minutes to get to 10 movements, which is fine. Learning your baby's normal to get to 10 movements is the pattern that you're seeking. And then after you establish that pattern, you would be able to see in the app, which we're going to talk about next, a change in that baby's movement. And that is when you want to alert your provider if there's a change in your baby's normal. And again, your neighbor's normal movement pattern for their pregnancy and their baby could be very different than your normal. So we're learning your baby's normal. And there could be a difference between, if you're in your third pregnancy, between the movement pattern of your first child to your third child. So learning it for that pregnancy, that baby is important. And you can use this free Count the Kicks app. I encourage you right now to get out your phones and download that app if you don't have it on your phone. I'm going to talk through the features of this app, but it is something that if you're working with expectant parents, if you're an expectant parent in that third trimester, we want you to have this on your phone. It is a huge educational resource. So our app, as I mentioned earlier, is in 14 languages, and I won't read those, but they're listed there for you. And that list continues to grow as partnerships are created, as funding is the opportunity to add more languages is created. We do add to that. You can find the app in both the Apple and the Android store. Users can restart their kick counting session or delete a kick. So you accidentally hit 2 kicks. You would tap this little blue footprint up here, and notice that as soon as you tap the footprint once, the time tracker starts. And then when you hit that 10th kick, the time would stop. And so that it would go into a chart of what your baby's normal is, which is the next graph. You can set a daily reminder to count the kicks. You can review your kick counting history. You can download your history to share it with your provider, family, or friends via text or email. This is a really powerful tool. So if you notice a change, you actually can share that data. You can count the kicks for twins. You can track future pregnancies on the same profile, and you can manage multiple devices registered to your account. So if you have an iPhone, an iPad, or an Apple Watch, all of those devices can be on one account, and you can count the kicks on a smart watch. So that's exciting as well. I talked to you about the strength of movement being important. So after a kick counting session, you will have the opportunity to rate the strength of your baby's movement. So one is that like fluttery light, almost that very first time you felt baby move kind of feeling, butterfly-ish, light movement. 2, rating it to number 5, which is fierce. Fierce movements are those, oh my goodness, their little elbow just came out my side, my belt. You can actually see movement on the outside of the belly, those really fierce, strong movements. And you rate that. And over time, you would then be able to see, this is the graph that's created for movement change. And this is the graph that's created for strength of movement. This is all data at your fingertips. And you can also add notes. In this, the note says baby felt strong like normal. So if mom said, oh, I, really was distracted and got interrupted several times in this kick counting session. So if that session showed a little bit of variation, she would know that might be because of the session being so disrupted, for example. So this is all on that app as you're hopefully downloading it. You can also see the menu of items. We do have video capabilities on our app to help educate users. They can watch how to count their kicks. They can read baby safe stories. They can learn about why they should count. There is also an amazing resource page to help get to low cost or free resources in your area. On the app, you can go and input your zip code. Here we put a suburb of Des Moines, Johnston, Iowa, and note there are 2,026 programs that show up in categories such as food, housing, goods, transit, health, money, care, education, work, and legal. So free and low cost resources that are available. And so we want to make sure to connect. We know those social determinants of health can impact birth outcomes, can impact expectant parents' health if they don't have access to appropriate health care or medical care during their pregnancy. So we want to make sure we connect those expectant parents with those resources. This is a living resource. And so if there's a resource that's not listed that should be listed in your zip code, send me an email. You will have access to my email. And so send me an email and we will make sure that gets added. This is a great video to show you how to use that Count the Kicks app.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
So I do hope that if you have not downloaded the app, you will do that today and just explore that. It is a great free resource. And again, if you don't have access or your clients or patients don't have access to the mobile technology they need or the internet, they can download paper charts from our website and use that to track their baby's movement. So let's talk about how you can talk about stillbirth with expectant women. It's so important. Yes, it is it is a scary topic, but we talk to women all kinds of pregnancy risks. We talk about of not changing cat litter, don't eat sandwich meat, take your prenatal vitamin, don't drink alcohol when you're pregnant, get your gestational diabetes test. We do all kinds of preventative education, as we should, and discussions. Stillbirth should not be the exception. It should be the rule. Some people might say, I don't want to scare moms. Again, pregnancy is full of risk. We don't use that mentality when we say, don't get a mammogram. We don't want you to be afraid of breast cancer. We don't say, don't take your folic acid because your baby could have a birth defect. We want to make sure that moms know that stillbirth is one of those risk factors so that they can protect themselves and their babies, and they know the importance of advocating. Stillbirth just happens. There's nothing we can do. Actually, there can be warning signs if a mom is educated to know what to look for and empowered to speak up. If she's not educated, she won't recognize the warning signs the baby's trying to give her, including a change in movement. Her baby is always active. It's not a concern. Babies are active until they aren't. And it's important to be able to establish if a slow change in movement is happening or if an abrupt change in movement is happening. And so I think it's extremely important for every baby, whether it's very active baby or kind of a sluggish baby, to be tracked. So a change in that baby's normal can be highlighted and spoken up on. She's almost at her due date. The risk of stillbirth actually increases as a mom approaches or exceeds her due date. After 40 weeks, the risk increases tremendously. At 37 weeks in that term stillbirth rate, that is when baby is totally viable, but the risk of stillbirth is actually increasing in that time period. And so overdue babies have extremely high risk of stillbirth. So just keep that in mind. What do you say to a mom that's previously had a stillbirth? This is an important conversation. Please note, you're still going to have the conversation about kick counting. You're still going to talk to mom, but before you enter that room, and this should probably be with every patient, but if you're a provider and you're a doula, you're providing support to expectant parents in some way, make sure you know their story if it's possible ahead of time. And it is in a provider's office, read that chart. Since women who have had a stillbirth are more likely to experience another stillbirth, talking about tracking that baby's movement at 26 weeks in a high-risk pregnancy is very important. Feel free to talk about the previous stillbirth and acknowledge the child. That child was a loved member of their family. It often has a name, and many stillbirth families want to remember, honor, and they do love that child, whether it took a breath on this earth or not. And so it's really important to stay away from medical terms like fetal demise. Empathy, open discussion, they're very important. And talking about tracking movement is extremely important, but not applying guilt to the past loss. Just ask mom, has anyone ever talked to you about tracking movement? It's something we're going to want to do in this pregnancy. And we have this great resource for you to do that with. So it's really important that you not make them feel like they missed doing something to get their baby here safely in the last pregnancy. This is a very important part of our presentation. These myths are myths that I believed, that many people in this country still believe, and are exasperated online constantly across social media and the internet. And so I want you to pay especially close attention to these myths. So my baby is always active, so I don't need to count the kicks. I already talked about that. But what I want to highlight is a story by one of our ambassadors. And she would tell you that the baby that she lost to stillbirth, Liddy, was her most active baby. In fact, Liddy was so active that Heather would say, I almost stopped paying attention because she was so active. It just became a part of my body and a part of my day. And so I wasn't sure when her movement changed and how much it changed until I noticed that she had stopped completely moving. And so we want to make sure all babies are being monitored. Only those experiencing a high-risk pregnancy should pay attention to their baby's movements. False. Many, many babies are lost to non-high-risk pregnant women. Every mom deserves to have this information. Women should not be lucky to get their babies here safely. They should be empowered and educated to help get their babies here safely. My baby, this is a big one, should get 10 kicks in 2 hours. No, no, no. Every baby is different. And the recommendation to expect 10 kicks in 2 hours is actually outdated. Current research indicates moms should work to understand the normal amount of time each day it takes their baby to get to 10 movements. It's very dangerous to put that time limit on it. I've heard story after story where the mom knew something was off, knew that their baby's movement had changed, but because their baby got a kick, like they counted kicks and is done in 1 hour, 55 minutes. Under that 2 hours, they didn't speak up. And that is a huge regret of theirs, having that time limit or that information. I can just use a Doppler device to monitor my baby's well-being. Actually, we don't recommend this. Heartbeat is actually one of the last things to show a problem in baby's health. It is a late warning sign of baby's distress. When the heart rate is being impacted, baby is in serious distress and time is of the essence. And a baby has a heart rate until they don't. That's why we want you to monitor movement. It is an early warning sign that could possibly indicate potential problems that can be intervened with and protect that baby's heart rate and protect the chance of death. Expectant parents also are not trained. Not all Doppler devices that can be bought on the internet have the same capabilities. Expectant parents are not trained individuals, and they will oftentimes hear their own heartbeat and think it's their baby's heartbeat. And so we really believe that Dopplers are something that should be left to trained professionals. Common myth is if baby isn't moving, I should drink cold water or eat something sugary to get the baby moving. This is actually something that is a big myth, and it is something that we hear medical teams still providing this. Research has moved away from the idea. It's like you're trying to trick a blood test. You know how we have fasting blood tests? You don't want to trick the test, so to speak. If baby's not moving normally, it's trying to share that something is different, and it needs to be explored. And so we don't want, sorry about that, we don't want to intervene. We want to see that normal pattern, and we want to speak up if that pattern has changed. Babies kick less near the end of pregnancy. That is actually a big no, no, no. Babies do not run out of room at the end of pregnancy. The type of movement or how the movement feels may change. There may be more jabs and fewer rolls as baby runs out of room. Doing somersaults may not be its thing, but those feet are going to come out of the side. So the type of movement may change, but baby is living. It will still be moving. This is a huge myth, and we have got to debunk it. And it should still take about the same amount of time to get to those 10 movements. A baby should move up during labor and up through delivery. They're alive. They should be moving. Triage doesn't need any count the kicks education. So if you go to labor and delivery triage to get your baby checked out and they send you home because everything checks out, they need to send you home with kick counting information so that you are tracking that baby's movement. Labor and delivery triage is the perfect place to have count the kicks information. So other ways to integrate. So we're talking systems change here. So I'm talking to a wide variety of individuals on this webinar: doulas, birth workers, midwives, medical providers, expectant parents, community-based organizations, WIC workers, whoever you are, you're going to have to take this information and apply it. You know your system. How can you incorporate count the kicks into your system from the top to the bottom? What kind of systems change can you do? If you give discharge paperwork after an appointment, is count the kicks in that discharge paperwork so mom can have that information? Do you have all front desk staff trained? One really important thing is for a mom that has a concern to call into her provider and not wait hours for a response from a nurse or someone. Hours and minutes can matter. If the staff can't handle it, that person needs to be sent to labor and delivery triage. We don't want time to be a barrier. And I can't emphasize that enough. The front staff needs to know when a mom calls with a concern on movement, how that's going to be addressed and how quickly that needs to be addressed. If you have like an intake form or a family care form, include count the kicks within that. Giving glucose tests, that's a perfect time to have the mom download the app while they're sitting there and waiting and having the kick counting discussion. Can it be included in emergency medical records or health records? Every appointment in the 3rd trimester, movement should be discussed. And I don't mean like, is your baby moving? That is a closed-ended question. I mean, how is your baby moving? What is your baby's normal movement pattern? How long does it take your baby to get to 10 kicks? We need to have those discussions every appointment in the 3rd trimester. Here's an example of a gold standard Mary Greeley Medical Center uses as an after visit summary. Take note that they put count the kicks in that after visit summary. Do you have a form like that? Or perhaps one like this, Celebrate One in Columbus? They see about 2,000 Black and brown individuals a year, and in their one touch point, their intake form, they include count the kicks education about the app so that they know that at least someone has the opportunity to learn. Additional resources available to you. This is important, and thanks to the partnership with the state health department and Georgia Strong Families, we have the ability to offer you free printed educational materials. Notice they are bright, they are cheery, they are mom focused. We have promo posters in English and Spanish, how-to posters, which is the one on the screen, in English and Spanish. We have business size app card reminders that could be handed to any mom in any package. I have ambassadors that I work with that literally hand them to expectant parents in the grocery store. Hey, I see that you're expecting, congratulations. Here's a great app you should download and use. That's the end of the conversation. Brochures, probably the best educational tool that we provide that educates mom in those 5 steps of how to count babies' movement and speaking up. These are free. There is a QR code on your screen. What I'm going to do now is encourage. I would love nothing more than to see orders flock in from the state of Georgia. They are free to you. They are on our website, www.countthekicks.org. And I'm actually going to play a little song, give you a couple minutes. Anyone that orders materials today during the presentation gets their name put in a drawing for Amazon gift cards. And we would love to send one to you. So right now is your opportunity to order those materials. Go to www.countthekicks.org. And let's get happy and order some materials. I'll give you a couple minutes.
It might seem crazy what I'm about to say. Sunshine, she's here, you can take a break. I'm a hot air balloon that could go to space. With the air, like I don't care, baby, by the way. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel
So I hope you took this opportunity to order those free materials. And I'm so excited. I see that there's at least one done in the chat. All those names will be put in a drawing for an Amazon gift card. So go ahead and finish up. You just went to the order materials tab and went to the great state of Georgia where it's free, free, free. And there's really no individual that doesn't have the opportunity to order those materials and disperse them amongst family, friends, their organization, patients, clients. And so I really encourage you, you could be literally saving babies' lives just by sharing this education and information, no matter who you are. So thank you for ordering those materials during the presentation. And thank you for being happy with me. What else can you receive? There is a low-cost training in the state of Georgia for CE trainings, continuing education trainings. And so that link will be included in this PowerPoint presentation. Other free resources, our website is full of free resources, folks. www.counttthekicks.org is your free go-to resource for a parent academy, how to count the kicks, everything a parent needs to know, including ways to speak up and break down barriers. Provider Academy, how to implement this in your practice. And provider could be a doctor, a nurse, a clinic manager, midwife, a doula, any type of support person. Really go there and find out more about how you can implement and think about those systems change. Kick counting charts that I've talked about can be downloaded for free there. And there are multitudes of educational and empowering videos available on our YouTube channel and on our website. Finally, another free resource on our website is our sample lesson plan for educators. And so we are always trying to provide those tools and resources. So if you're a childbirth educator, this is a great addition to what you're doing. Please download and print those childbirth education plans today. So we do have an amazing ambassador in the state of Georgia. Erica Aiken is a mom who experienced the loss of her daughter, Alexandra, and works in honor of her. She believes very much in this education that she did not have and believes it could have made a difference in her story. And so a Count the Kicks ambassador is a highly trained public volunteer who shares their time, stories, and talents, whether it's to go to baby fairs, give media interviews, attend medical conferences, grow to work on partnerships like state health departments and community-based organizations, some fundraise. There's so much that they do. And so you have that free resource in your area. And so there's Erica's name and contact information again that will be shared after this presentation. And so if you need someone to do a training or you have questions, you can ask myself or Erica. And so she is in the Atlanta area where I know several of you are located. And why are we doing this? Why do we come together? This is the impact, folks. Look at these beautiful faces. These are just a small sampling of the babies we know that have been saved. We have nearly 100 baby safe stories for you to see on our website and read. They're really powerful stories where simple education on kick counting made all the difference in getting these beautiful babies here safely. And so I just highlight that, go to our website, read more about babies and their stories. I love this quote by Eva's mom, Yelly. She says, "I am very grateful that Count the Kicks made me aware of the importance of paying attention to babies' movement, and also that my provider took my concerns seriously and took action. I pray that my daughter stays healthy and continues to grow to become whoever her heart desires. I highly recommend the app to all expectant moms out there. Happy and healthy deliveries to everyone." And that's why we're all here today. We all care. We want to have babies get here safely. We need your partnership in this effort, this very grassroots and top-down systematic change effort to get babies here safely. So this is the end result. This is why we're here. I'll include a link in the follow-up email to Nala's story, just out of the sake of time, since we have just hit the top of the hour. So it is a powerful story. I highly recommend you do watch that. So next steps, again, familiarize yourself with the Count the Kicks app. Practice, 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 share, share, share. It is an amazing tool and resource for free on both Android and Apple products. Order those Count the Kicks materials. We have a few more minutes where you can do that and be entered into the drawing. Take 3 to 5 minutes to educate your parents, have the kick counting conversation in every appointment in the 3rd trimester. You are a tool, a resource, a vast resource of education and knowledge You added this to your tool belt, add it to others' tool belts as well. Make sure your entire staff, your entire organization, anyone you can think of that needs to know about this campaign knows the importance of tracking movement in the third trimester so that 1 in 3 at-risk babies in Georgia can be saved. That's 333 babies on average in your state, and we need you to help get them here safely. Use those electronic forms, those intake forms, those, all the systems change we talked about. And remember, this is so important. Hours and minutes matter in preventing stillbirth. When a mom notices a change, it needs to be addressed. She needs to get to her healthcare team as quickly as possible. Remove all barriers. If a barrier happens, you got to go around it. If the doctor's not calling you back, you need to go to the hospital. You need to tell them that your baby's movement has changed. And that's what the app does for you. And connect with us. We are on Facebook, we are on Instagram, we are on Twitter. We have an amazing website. You can even sign up for our newsletter. So please stay connected with us, learn more about what's happening in our organization. We are doing some amazing things across the nation and in partnership with Georgia. And we are so grateful for the opportunity to present to you. I have Erica's number, contact information on this slide as well. And so